Hello, I'm Mark Weil, and I do natural medicine in San Francisco. And if you're watching this, I'm assuming you're watching because you want to know about why enemas might be appropriate and why I recommend them to people. So, the most important thing about an enema is that it's a self-care tool that you can learn how to take care of yourself in all kinds of situations, and it's relatively inexpensive. And why I recommend enemas, and I'm talking about enemas versus colonics, is because a colonics is usually going to cost you anywhere from $50 to $100. And once you learn how to do enemas effectively, it's going to cost you about $12.99 for a bag, up to maybe $50, depending on the kind of bag you have. And it will work much more effectively with a lot of the conditions that I recommend to people. So let's talk about what an enema is not. An enema is not a fleet enema. Those are the little bulb enemas you buy in the pharmacy, and a lot of people call that an enema. An enema is where you're using the 1.5 quart, 2-quart bag. A lot of times they're a pink one that you get. They look like a hot water bottle. And there's an enema douche attachment, and that attachment, it's easy to tell the difference between the enema when it's a small white tube. Now the colonic, a lot of times they'll tell you that a colonic gets into the body a lot more effectively than an enema. The reason I'm doing this video is to explain to you that you can make an enema even more effective than a colonic. And that's what I've been able to do with the people that I work with, is teach them how to do that. And why do I recommend them? And to a lot of the people that I see, is because there's many things that would surprise you that I can see results with when people do enemas. The obvious one is that if you have GI problems, people end up doing enemas sometimes to correct those imbalances. Now, if you have something severe like Crohn's, colitis, irritable bowel syndrome, or any other medical condition, or you've had abdominal surgery for any reason, those are the things that you're going to consult with some qualified healthcare professional to make sure that an enema is not contraindicated. There are a number of conditions that I use enemas for to help people. The obvious one is anyone that's had a history of chronic constipation or diarrhea or any kind of gas, bloating, abdominal discomfort. The enema is sort of a soft reset for the body. I'm not recommending enemas daily, and in no way am I talking about a retention enema. So that's really important. So I'm talking about using them to correct an imbalance that's hopefully been there for a short period of time. If you have longer chronic constipation or longer chronic diarrhea, then you definitely need to be consulting with someone so they can tell you how to do this effectively. The other thing is that since people think of enemas as relating mostly to GI, gastrointestinal issues, I find that in almost every situation where I have someone that has any kind of swelling, pressure, pain, as long as they've had all that checked out to make sure there's no other problems, so they had swollen lymph glands on a repeated basis, they have sinus or head issues, pressure in sinuses, pressure in the head, congestion in the lungs. As long as they've checked all those things out, they've found a lot of relief when they start to clear that because of what's called the GALT, the gut-associated lymphoid tissue, and that GALT will allow, as those lymph glands in your intestines clear, the things in the upper part of the body start to clear with it. The other things that I've seen sometimes affected really well by enemas are low back pain or certain kinds of back pain. Because most people don't, if you've had it all checked out and you don't have an injury or a trauma that's caused a problem, they don't realize that when the lymph chain builds up in the body, it sometimes puts pressure in some part of your back. So that would relieve some of those situations. There are a number of things that respond really well to enemas that I think might be surprising to some of you watching. So just earlier, in the earlier segment, I mentioned the GALT, the gut-associated lymphoid tissue. The most important part about that is there's lymph everywhere in the body. People think of it as typically around their neck, their armpits or axilla, and their groin. But we have lymph everywhere, and the way you'll know that is that when you've had a cold or a flu or a hangover or food poisoning, you've ached sometimes in every joint in your body. Well, the major place that all that dumps into is called the GALT, the gut-associated lymphoid tissue. And one of the advantages of doing enemas effectively is that you will clear the GALT. In that, when you've cleared the GALT, you can sometimes get relief in a lot of things that I think people are not used to using an enema for. I would constantly recommend it for any GI problem, but I also find that most sinus problems, allergies, frequent headaches or intermittent headaches that don't make any sense, because with all these things you need to see a doctor and get checked out. And one of the things that's really surprising to most people is that back pain, when you do not have chronic back issues, and you, again, get checked to make sure you don't have any ruptures, tears, herniations, dislocations, get an x-ray, get an MRI. But a lot of times I'll find that when I'm working with people that have had undistinguished back pain, they don't know why they're getting it, it's intermittent, they'll find that when they clear their intestinal tract, they can start to feel better almost immediately. And one of the things that you have to realize is that the intestinal tract isn't the simple shape that you think it would be. In many cases, it becomes a little contorted or imbalanced, and usually it'll be imbalanced on the side. If you had a back pain, you'll find more discomfort in your intestinal tract on the side where you're having the back pain. So if it's a right side back pain, check the right side of your intestine. Likewise, left side back pain, left side. So in many cases, even though it doesn't seem intuitively correct to say check out back pain for enemas, it does seem to work in a lot of cases. The other thing I've liked enemas for is for just a general reset when your system feels like you're really tired. Again, no apparent reason, and I'm not saying lack of sleep. So a lot of times over time when we're not digesting well and we're feeling like we're just run down and we're not coming back the way we would normally come back, it's a nice reset for that kind of imbalance. And a lot of times we'll be tired because we aren't digesting well, and so our whole system is actually working to refilter some of the waste, and we're not producing enough of the digestive enzymes that we need when we're diverting energy into refiltering.